What are some of the major health trends for 2015? Look no further than your local emergency services agency, experts say.
To having a bariatric support unit, we would have a regular size stretcher. We would put that patient on the stretcher, then with the assistance of other first responders like firefighters, put 4 to 6 people around that stretcher to try to lift them up safely. Obviously the risk of that patient falling or the stretcher tipping over, or as importantly, an injury to the first responders, injuring their back or their hand or something like that.
The abuse of opiate-based drugs, combined with the recent FDA approval widening accessibility of Narcan, is another big issue.
As long as those people are prepared for the medical consequences of waking that patient up, it's probably reasonable. I think that when patients wake up from an opiate overdose, they can start to vomit. They can become very agitated. If they vomit and they're not awake or fully awake, they can aspirate into their lungs. And all those things have high risk, and if you're not medically trained in how to deal with that, you may actually cause more harm.
Improving out-of-hospital cardiac arrest survival rates is another big priority for Bucks County Emergency Medical Services.
We had initiated in Bucks County a high-performance CPR program, and the main focus was to try to improve our out-of-hospital cardiac arrest survival rate. What we did was train our providers in the techniques of high-performance CPR, which essentially is immediate chest compressions, not stopping for pulse checks and things of that nature. The next project that we did with that, because we found that was being successful, was trying to get the recognition of cardiac arrest even better, done more rapidly. So what's happened with that is we've been working with our Bucks County radio room, the dispatch center, for 911 calls, and they have been part of a collaborative with us as well as with the Center for Resuscitation at the University of Pennsylvania, where we have been working to get our dispatchers better trained on how to recognize the signs and symptoms of a cardiac arrest when they're first getting the call, and then also how to more quickly start CPR, and when we do start CPR, getting them to do high-performance CPR at the point of collapse.